Hello and welcome. In this lecture, we're going to be talking a little bit about evidence that informs healthcare practice, which has been published in the literature, so research papers of various different sorts. And the goal of this lecture is to give you an idea of the landscape of the different types of papers that are out there and what they mean and what their implications are for guiding effective care. So, again, let's remind ourselves that publications really play a key role in our conversation around research and our conversation around evidence supporting different ideas in the field. And that's because it's part of that community feedback and analysis in a very focused way. Research publications from scholarly journals are seen as being of higher quality, in part because it goes through a peer review process. So there's a level of scrutiny of these types of papers that doesn't happen for other types of publications. And there's often efforts to replicate it. There's a general conversation within a field about these types of papers that generally gives us greater confidence in them, and it means that they tend to be used a little bit more as support and citations when we talk about scholarly work and trying to gather information about health that we feel confident can support changes in practice that will help people. So in all honesty, in terms of thinking about how to talk about this, I recognize that talking about lots of different paper types may not be the most exciting thing in the world. It's still really quite important. So it might be something that we'll have to just go through and accept that it might not be thrilling, but that it will be helpful for us getting a general picture of what's out there. In all honesty, it's actually often better to actually go and see examples of these papers so that you get a picture of what they look like in reality, and so that you can identify them more quickly and figure out which sort of pile of scholarship they go into, and each of those piles sort of have different implications for how they would be used in terms of guiding healthcare practice. All right, so nonetheless, we're going to go ahead and we'll do a brief overview of what these different types of papers are. All right, so I'm going to be using the ranking from Schmidt and Brown, the textbook Evidence-Based Practice for Nurses, to frame this conversation. And they have presented a schema of essentially a ranking of different types of literature based upon its strength for making recommendations. So as we look at this ranking, we go from the top levels, which are things like systematic reviews and meta-analyses that focus in on randomized controlled trials, down to the lower levels, which are really more focused in on things like expert opinion or general literature reviews. So across this range of literature, each of those sort of rankings have different implications. Now let's just be clear again about what those implications are of those different types of ranking. So the ranking does not mean that papers that fall into that top category are of high quality. You can have papers that fall into the top category which are very poor quality and are poorly put together and actually are not accurate at all. Okay, whereas you can also have narrative reviews, which are in the bottom category, which can actually be very thoughtful, very careful, and very, very insightful, that can really be helpful for us thinking about practice and improving public health. So quality varies across all these different rankings. What this ranking really is trying to say is it's essentially the confidence that we have that there's an association between an independent variable and a dependent variable. So in other words, the different types of publications that fall to the top of that ranking, we are more confident if they say that some health intervention has an impact on a health outcome, that we're actually confident that the connection between those two variables is solid. All right, that if you take this medication, that it's more likely that it is likely that actually has an impact on a health outcome. As we go to those lower levels of publications, they tend to be less reliable in terms of making connections between different variables. Okay. So that's essentially what this is trying to say in terms of those rankings. So let's go through some different types of terminology and types of research that we're talking about. So much of the research that's talked about in this ranking is what we would often consider as being original research. So original research is research where scholars have actually generated new knowledge. And they've done this by asking a discrete question, often with a hypothesis, but it can be a broader question than that. They would have a clear methods that they've used to address that question. They should present the results, their findings from looking at this, and they should say something in analyzing and interpreting those results. And that's what we're talking about when we're talking about original research. It's something where we've generated new knowledge. Now, there's a sort of subcategory of this, which is primary research. And this is original research where authors have gone out and collected data themselves. They've gone and done the study themselves to get that information. There's also secondary research where scholarship where you've gone to primary research to combine information or synthesize information about a topic, where the authors are not necessarily doing collecting the data themselves. Okay. Now, there's a term that's often used, and I'll use it very frequently, which is just the term review. Review is a term that can be confusing because when I say, oh, you should look at a review or you should do a review or something like that, it can mean actually a lot of different things. Okay. So let me just try and make this a little less ambiguous. So a review can be something that we do. So it can be a verb. It can be something that we're going to go and review the literature to find out information about a topic area. So I have a clinical question or a public health question. I want to go find out what information is there. So I'm going and doing a review to collect information. A review can also mean, can refer to essentially the background, the review section that's in the introduction to a research paper. So here authors have gone and actually, any author is going to give you some background information where they've reviewed the literature and they're providing you with their interpretation of what information you need to know to understand their paper. Okay. There's also reviews which are distinct publication types. So the paper itself is entirely a review. And I'm going to talk about some of those reviews as we go forward. So I'm not going to go into detail about that now, but those are narrative reviews, systematic reviews, metasyntheses, and meta-analyses that sort of fall into this general review category. All right. So when we're looking at these categories in the ranking that we talked about here, there is that sort of lower ranked category that has a range of different types of information. Now, as we go up through the categories, a lot of those different types of information, like qualitative research or randomized controlled trials or cohort studies, these are all things that are original research. Okay, so I'm not going to talk about them a lot here because I will discuss that in other lectures. But you'll also see systematic reviews and other types of reviews coming throughout this ranking, which I'll discuss shortly. But in that bottom category, we have a range of different types of things like expert opinion, which is often, you can get that in publications through, for example, commentaries. So sometimes journals ask an expert to write their opinion about a topic area. Now, these can be actually really interesting and engaging. But they also are subject to the biases of the author because the goal here is to provide an opinion. Okay. There's also things like manufacturer recommendations for how one should use a device or a medication, for example. And that's often based upon scholarly work that's been done by that company manufacturer, right? So that's seen as being useful information that one might use to guide practice in some way. There's also clinical protocols. So different organizations can publish these recommendations for how to carry out procedures. So that can be at a local hospital, for example, that's put together this protocol that you can sometimes use. There's also reports. Some of these reports I talked about in terms of unpublished data, some of those reports are actually pretty highly regarded and can be useful for guiding practice. You also see sometimes position statements. So these are organizations making recommendations about how to handle different types of situations. Often these position statements, I've written position statements, essentially you get a group of experts together, and they might look generally at the literature and essentially say what they think the answer is here. I'm going to talk later about actual clinical recommendations, official recommendations, guidelines, and those sort of fall into a different category. Those are much more thoroughly developed than a lot of these position statements. And we have sort of, in addition to those position statements, we often have sometimes these more general clinical recommendations that may not meet the criteria of being sort of official recommendations. Now, we also have what we call narrative or traditional literature reviews. So I'm going to talk about those a little bit more specifically. So narrative reviews are reviews that are presenting the perspective of experts based upon their interpretation of the literature. And they will have gone to the literature and done a review and tried to say, based upon their perspective and opinions and experience, what they think the answer is about this health-related topic. Now, the way that you can tell that this is a narrative review versus other types of reviews is typically they won't say a whole lot about what their methodology was for doing this review of the literature, okay? They might say a few words about different types of terms that they searched, but it wouldn't be something where you could go through and precisely replicate what they did, all right? Sometimes these reviews are also written by a single individual, so there's a lot of potential for bias in those types of publications. Now, there are some real advantages to these traditional narrative reviews. Typically, they're written in a style that's actually pretty accessible. They're more fun to read, so you get a little bit more of the perspective of the author. It tends to be a little bit less formal and a little bit more engaging. But as I mentioned, because it's really this author's perspective on the literature, there's a lot more potential for bias in these types of reviews. That being said, they're really quite helpful. I like them, and very often they're sometimes the first thing that I go to when I'm trying to learn a little bit about a specific area. Now, there's another type of review, which is called a systematic review. Systematic reviews and the reviews that follow from this point forward are seen as being a higher level of evidence. And this is because they essentially follow, even though they're a review and they're looking at other publications that they're assessing, some people view them as secondary research. But in many cases, they're certainly seen as original research because they actually use distinct methodologies that are replicable. And because they pull together data from lots of other papers, they're often really quite highly regarded. So that's true for the following different types of approaches I'm mentioning, because they have these distinct methodologies that are highly respected. So here for systematic reviews, essentially what's happening is you create a distinct question that's relevant to healthcare, and then you have a replicable methodology for how you identify papers that answer that address that question, and you're very clear about how you did your search to find papers, why you excluded different things or included different types of papers, and how you analyze and combine that information. So there is a clear methodology to these, and ultimately, based upon what they find, they will actually synthesize that research to give you their perspective on the literature. However, they'll also present that evidence to you, so you will be able to see evidence from all these different papers that they've identified, and they should have identified in this search all of the relevant papers on this topic area. So you can go through that list and you can sometimes form your own opinion, or you could go to those articles and look at them yourselves and see if you think that this is true or not. So there's a few things about this that are notable. One is that these papers tend to be a little bit more formally written. You see less opinion coming into these papers. But because of this comprehensive and systematic methodology, they're seen as being less vulnerable to bias and seen as being a higher level of evidence. So here, I just want to show you an example of what a systematic review might present. This is just the different papers that the systematic review identified. And what they'll do is they'll say a little bit about, they'll say who the authors are, they'll say when it was published, they'll say a little bit about what population was studied, a bit about the research design, they'll describe what the findings were for those papers, and talk about other relevant things to their systematic review question. So again, as I was mentioning, for systematic reviews, you can go and look at this chart, and to some extent you can form your own opinion and see what the scope of evidence is that's out there. All right, so what is a metasynthesis? So metasynthesis is an interesting approach that's gaining more interest recently. It's been around for a while, but they are somewhat less common than some of the other approaches I mentioned. And this a metasynthesis is essentially where a researcher who's asking a question that's best answered by qualitative research will do a systematic review to find lots of qualitative research that addresses that area, and then uses a distinct process and methodologies to combine that information to get an answer to their question. And this is a pretty highly regarded approach for thinking about qualitative questions. So it's certainly better, if you like, the ranking than individual qualitative studies. So meta-analysis falls into that top category when it comes to the ranking of literature. And what a meta-analysis is it's a systematic review of quantitative research where they've actually gone into the papers, the quantitative research that they found, and they've pulled the data out of it, and they've combined that data to yield an overall estimate of the impact of whatever clinical thing that they're looking at or healthcare risks that they're looking at. Because of the methodology that they use to calculate this, and because they're combining multiple papers as opposed to looking at individual studies, this is actually a very highly regarded type of publication. It's typically seen as you know, the top of that ranking in terms of evidence. You can see that meta-analyses can be done at different levels. Depending on the source data that you're using, it will come in at the different ranking levels. But if you're looking at something like randomized controlled trials for, say, drug trials, for example, this is seen as really the top evidence in terms of connecting an independent variable to a dependent variable. Now, let me say some things about the strength of meta-analyses that are worth thinking about. First off, you'll see in these meta-analyses, they will combine different studies. So they'll show the studies that they looked at, the data that was pulled out of it. In a forest plot, you'll see that the dot represents the size of the sample, how big the study was for each of those studies. And then at the bottom, you'll see the combined data. So that diamond at the bottom represents the center and the area of confidence that they have for the combined data across those studies. So this is actually really very helpful for looking across multiple studies. Many of those studies, for example, in this chart, may not have seen a statistically significant result, but when you combine them together, you get a more a stronger finding in terms of showing whether or not there's an impact for that health issue. The other thing that's neat about meta-analyses is it can look, one of the things I can do is I can look at heterogeneity. So how diverse is the literature that's out there? How consistent is that literature? But it can also actually detect if we might have problems with the source data that we're looking at. And I've mentioned before the idea of publication bias, that papers that find a positive finding in this, that there's something that's a positive result that proves a hypothesis that, say, a medication will cause a health impact, those tend to be published at a higher rate than things that show that there's no relationship. So that's a big problem if we're trying to combine information together. But these meta-analyses can actually look at that, and they can chart using a funnel plot to essentially see whether or not there's asymmetry in the publications that are out there. And I'm not going to go into this in detail, but the point here is that especially for smaller studies, if you see that there isn't an even distribution across this funnel plot in terms of studies falling to either side of that median, that may indicate that there's actually publication bias in the work that's being looked at. So that would suggest that the findings of the meta-analysis may not be able to be used because the literature that's out there is skewed. Now, this is actually a really important finding for a field that you can't identify without doing a meta-analysis. So that's suggesting to the field that what we've been looking at may actually not be accurate for understanding a health-related problem. All right, so there's also sort of official practice guidelines related to health-related issues. So these might be guidelines around what you do in the clinic, what things are you required to do to take care of a patient, or what types of preventive services do you want to offer. These are by highly regarded agencies and organizations, very often governmental or governmentally backed agencies and organizations. They are, the top level organizations for a field typically. And these guidelines are typically developed by teams of experts who go and conduct a very extensive review of the literature using a systematic approach. And they'll also include other types of information that are relevant to understanding how this plays out in clinical practice. And then they provide recommendations for what should be done in practice. And this is seen as being, this is sort of the ideal evidence-based practice approach because it is such a rigorous process to go through. So just to give an example, this is a U.S. Preventive Service Task Force. This is their sort of ranking scheme as they go through the literature. So they'll look at this range of different literature to look at what evidence shows that a different type of procedure, whether it has a benefit for health, whether or not the literature is of high quality or not. And they will make recommendations based upon their assessment. And here you see A, B, C, D, and I, essentially their scale for saying, look, this is really good. We think that you should do this. You should offer the service. B is saying, we're pretty confident that this is good quality evidence and that it has a benefit. Then you have C, which is something where there's some indications but we're not super confident, so maybe do this, maybe don't. And then you have D, where the evidence is actually suggesting that they're pretty confident that this doesn't do anything, or they're confident that it actually may cause harm to do this practice. So they're recommending that you do not do this practice. And then I just suggest that the evidence out there is inconclusive. So there's different types of schemes for doing this type of ranking, but when clinical guidelines are developed, they're going to be using some scheme that typically looks something like this. All right. So this is essentially an overview of the different types of publications that are seen as being really strong evidence to support changes in clinical practice. They vary in terms of the ranking, as I showed there, and each of them have their strengths and weaknesses. But it does give you sort of an overview view of the different types of literature that's out there and what their meaning is for guiding us towards improving healthcare practice. So thank you very much for listening, and take care, everyone.